a crushing burden. Data shows for far too many Kentucky families. Medical debt already out of reach, often piling up to the point of bankruptcy.
In our last hour, our national investigative team showed you just how widespread the diagnosis of debt truly is.
Tonight, WKYT's Garrett Weimer shows us the growing crisis here in the Commonwealth and how Good Samaritans are trying to bridge the great health divide for low-income folks facing steep medical costs all across Kentucky.
These are all Kentucky counties.
It's a simple spreadsheet.
Recipients, amount abolished in that county.
But when Josh Miles looks at it, he sees much more.
Every number's a person. Every number's a story. It's not just an individual. Some of these are families. So when you're talking about 803 people, like that's a wide scope to impact and change people's lives.
It's why Miles says their congregation here at Louisville's Westport Road Baptist Church got involved with RIP medical debt. The organization acts like a collections agency, buying medical debt in bundled portfolios, allowing donations to pay off that debt at pennies on the dollar.
It was just an issue that we heard that was in our community and in our nation, that it's such a major source of financial burden for members of the Commonwealth, and we thought, how is it that we can get involved?
With $15,000 they set aside to help, they've already abolished $1.1 million in medical debt owed by more than 800 people across 97 Kentucky counties and parts of Tennessee. They'll be able to help forgive $600,000 in more debt this year. The issue truly does reach all throughout the Commonwealth. Data from the Urban Institute shows more than 18% of people in Kentucky have medical debt in collections. That's close to 1 in 5, and it's above the national average of about 14%. Now, in Kentucky's Appalachian counties, the share of people with medical debt in collections is even higher, more than a third in Carter, Boyd, and Johnson counties. In fact, 13 of the 16 Kentucky counties with the highest percentages not only are all in Appalachia, but also all have shares of more than a quarter of folks with medical debt in collections. A 2019 study found that medical debt remains a top reason for bankruptcies across the U.S.
That is not okay.
Miles and others here at Westport Road Baptist Church hope that by helping, they're making an impact in a tangible way.
Like, that's just astounding to say something so small, we can be a part of something so big.
For members of this church and others around the region, the message is especially appropriate in the days now after Easter.
We believe that God has forgiven us and that we should help also forgive the debts of other people in our community. So I think it's a central part of our own faith, is to have the chance to give what we have received in Christ.
They hope others able to help can get involved too, knowing the burden of medical debt is a heavy cross to bear for far too many across Kentucky. In Louisville, Garrett Weimer, WKYT.
Well, it's eye-opening, and so is this. A new report from the Consumer Financial Protection Bureau says Americans have an estimated $88 billion in medical debt listed on their credit reports. If you'll go to our website, we have information about how to find a medical advocate to speak up for you. Just click on this story on WKYT.com.